Hi, I'm John with Physical Therapy First, and the next group of exercises I'd like to demonstrate is to help restore lumbar pelvic range of motion and joint proprioception. Joint proprioception is the joint's ability to feel directional movement. When we have back pain, our joints can get stiff because our muscles are guarding, and we can lose the ability of joint proprioception. The group of exercises that I like to do for lumbar pelvic range of motion, I start with the lateral pelvic tilt. The patient's sitting on the physio ball with their hands on the side of the physio ball. And then they tell the patient to bring your right hip towards your right ear, and then gradually move it that way. And then we go to the left and do the same thing. Now I like to have the patient repeat this 20 to 40 times. And this exercise can be done every day. The patient may sense an asymmetry in the motion from going right or left, and they can actually focus a little bit more of the repetitions in that direction. This should not be painful. But with patients that have had back pain for a while, sometimes their range of motion is so limited, they may have difficulty sensing much movement at all. And so this is one that needs to be practiced and often needs to be practiced every day. So the second exercise I like to do for lumbar pelvic range of motion is the anterior-posterior pelvic tilt. This time, the patient's going to have their hands on their iliac crests, and then they're going to start with the posterior tilt, bringing their hips forward, and then doing an anterior pelvic tilt. And again, the patient may have very limited range of motion, and it may feel like they're not moving at all. So it's going to take, sometimes the therapist will use their hand for tactile cueing so the patient can feel that and then give verbal cues that let them know that they're doing the motion correctly. So let's do a few more repetitions here. So that is a posterior pelvic tilt, an anterior pelvic tilt. I like to do this 20 to 40 times, and you can do it daily. And this will help restore your joint proprioception and your joint range of motion of the lumbar spine. The third exercise I like to do for lumbar pelvic range of motion is pelvic clocks, where you can move the pelvis in clockwise and counterclockwise directions. The patient starts with their hands on the iliac crests. They're going to start with moving the pelvis in a clockwise motion. And what you'll find is this is a combination of the anterior-posterior pelvic tilt and the lateral movements that we practiced in the beginning. This exercise should be completed every day to help restore proprioception and help improve lumbar pelvic range of motion. And after 20 to 40 times in one direction, you can repeat it in the opposite direction.